Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health. And on today's video, I want to share with you a fascial release technique I use for my lower back. Now, this video is for you folks out there if you have chronic low back tightness and stiffness that you can't seem to get rid of, or if you just someone that has no trouble at all with your lower back, but one particular morning you wake up, your low back feels stiff, it feels tight, you know you need to get to the gym that day, and you want to loosen it up. So either way, this is a great technique to use. Stretching is great. You want to do regular stretching. I have lots of videos. We do stretching, but you also notice I do a lot of videos on fascia release technique, and that's because sometimes stretching just isn't enough. You need to do some fascia release. So before I show you the fascia release technique we're going to use for the lower back, let me just go over, you need to understand the anatomy and the fascia a little bit, or what I'm going to go over today is not going to make any sense. So first off, it's important to realize, and if we're looking at the spine from the back, if we're looking from the back, that there's fascial bands. And the fascia, in case you're unaware, is that fascia is this saran wrap type covering that covers muscle tissue. It surrounds muscle fibers, muscles, groups of muscles, and there's these big bands of fascia going across the body in all different directions. And there's bands that come across, say, the left side of the body from the lower part of the body, and as it crosses, as it comes up on the lower back, it actually crosses to the right side and then comes up along the right side of the body. So fascia that's on the left lower body can end up crossing, the same fascial strips will come and be across onto the right side of the body. So what does that mean? Well, think about it. If there's fascial restrictions on the left lower part of the body, and there's fascial restrictions there, it can actually affect your right side. So it's not unusual. Sometimes patients come into my office, left lower back pain, right upper back pain. You know, and it's like, well, it doesn't make any sense, but it does because the way the fascia runs. So we're going to go over a technique today to break up some of that fascial adhesions that might be building up in your lower back. It's going to loosen you up, it's going to make you feel great, and it's going to get you to the gym today, and it's going to make you have a great workout. All right, so here we go. Here's how we're going to do it. You're just going to need a bench, or you can just do it right on the ground. We're going to need some type of fascia release ball, massage ball. Of course, here we use Tai Chi balls from OcraMed Health because of the awesome texture to these balls. It gets deep into the fascia. If you don't have one, that's fine. Tennis ball, lacrosse ball, something small though, you can use. Because of what we went over as far as the fascia goes, you're going to notice I'm going to be demonstrating a release on the left side of my lower back, but the stretch we're going to be using is going to take place on the right lower part of my body. So I'm going to demonstrate the fascia release technique for the left lower back, which means we're going to be placing the ball along the left side of the spine. Now, where are we going to place it? Well, if we're looking from the back here, we obviously don't want to be on any bony prominence. You'll know if you're on bone, it's going to be very painful. If you're on your sacrum, if you're on your pelvis, if you're on your lumbar spine, we don't want to be on the bone. We want to find the area above the pelvic crest. You can put your thumb in there. You'll find that bony ridge up in here. You want to be above the pelvic crest and to the side of the spine. You don't want to be on the spine, like I said, and you'll feel the soft tissue in there. You'll know when you're on soft tissue because the ball will kind of sink into the soft tissue, to the muscle, and to the fascia. So we're going to be kind of in this area, and of course we're going to do this in 2 or 3 spots, so we'll be moving the ball a couple of times, but that's where we want to be. I'm going to demonstrate, like I said, the left side. Okay, so what are we going to just grab a pillow so you can rest your head. Like I said, I'm going to be using this. We're going to do some fascia release work along the left side of my lower back, and we're going to do it a couple of different ways. We're going to start lying back this way. I'm going to get that ball on the left side of my lower back, kind of right where I was showing you, between a little bit above the pelvic crest, but off to the side of the lumbar spine. I have my knees bent up, my head is back. Now in this position, you're going to feel a little bit of discomfort on the, where the ball is. Of course, we've mentioned this before, just again, real quick. Fascia release work it's going to be a little uncomfortable. It's not fun. You got to gauge your pressure. Don't think you're going to put all this pressure and dig out these fascial adhesions all in one shot. Give it some time. If you've never done fascial release work, definitely go light. If you're used to it, you can go a little more pressure. But this is, this fascial release work, it's someone, unlike stretching that can be relaxing, fascial release work can be uncomfortable. I've mentioned this all the time when we do fascial release videos. So gauge your pressure. It can be a little sore the next day. It can leave you with a little black and blue mark the next day. It's okay. It's all for the good of keeping us healthy and for getting us into the gym and continuing the workout. So anyways, the ball's on the my left lower back. My knees are bent up. My head's resting back if you want to use a pillow. And from this position, what I'm going to do is I'm going to grab my right knee and I'm going to pull my right knee as far towards my chest as I can. And you're going to notice as the farther you pull it up, you're going to feel some real deep release from that ball now in this position. I'm going to hold this for about 30 seconds. And as I'm doing it, I'm going to try to breathe through the 30 seconds. So I'm going to take nice deep breaths in through my nose and out through my mouth. I'm going to hold it for about 30 seconds. I'm going to let the knee come back down. And now at this point, I'm probably going to just bring the ball up maybe about a half an inch, a little bit higher. And again, I'm going to pull back the knee and I'm going to hold it for about 30 seconds. So I'll probably do maybe 3 different positions with the ball. Once you get up too high, the fascial release technique isn't effective anymore. So I would only go up, move the ball a couple times, so maybe hit 3 different spots on the left side. 30 seconds hold on each one. Now after I do that, I'm going to go back to the starting position again. And this time it comes in handy to grab a belt or some type of strap for this next one. And get the ball back into our starting position. All right, I'm still on the left side. I got the ball in there. I can feel some pressure. I got both knees are bent up. But now I'm going to take the strap and I'm going to put it around my right foot. Like that. I'm going to keep my leg straight. And on this release technique, I'm going to bring my leg up straight as far as I can with this knee. The left knee is bent. And of course, as you're coming up, because it just proves how this fascia runs across, because as soon as I start pulling up on this right leg, I feel the fascia release on the left side of my back, and you really feel that Tai Chi Ball just releasing that fascia on the opposite side. And I'm going to just bring this leg up as far as I can, and I'm going to hold this now for 30 seconds in this position. Once again, breathing through, in through the nose, out through the mouth, trying to relax, let the fascia release take place. Come back down, move the ball up into the second position, maybe a half an inch up, bring the leg back again, and just stretch it back as far as you can with the leg straight, using the strap to pull, and you're going to hold that for 30 seconds. So first part of it, the knees bent three times, 30 seconds, then come back with the strap, keep the leg straight. Do both sides. It's amazing the release you feel in your lower back by the time you're done. If you started off with a stiff, tender lower back, don't be surprised that you're just going to feel great. Follow that up with a little light stretching and get into the gym. All right, so there you go. I'm really excited for you guys at home to give that a try on days where your back is feeling tight, stiff, sore. I think you're going to really find that technique helpful, and best of luck if you're suffering with a tight, tender lower back. All right, exercise programs, mobility plans, and our new SRI shock release instrument. This thing is the best thing I've come across. I use it on patients all the time. Gets deep into fascial adhesions, breaks it up, works awesome. I'm using it in my office all the time now, but it's available, all those things, on my website, www.OcraMedHealth.com. All right, if you're enjoying these videos, please subscribe to my channel, OcraMed Health on YouTube. Questions about exercises or injuries, just leave a comment in the comment section below. I always get back to everyone who writes in, because OcraMed Health is here to keep you fit forever.